Yeah, this is Friday afternoon, and we are back with one another episode of our Forefront of Future Frontiers, the medical webinar series, which is being organized by the Scientific Society of Arupadavidu Medical College, a constituent college of Vinayaka Mission Research Foundation deemed to be university. On behalf of the Scientific Forum and Team AVMC, myself, Dr. Mahalakshmi, Dean Health Professions Education, welcome you all for this today's program. And we are here on this is a theme-based webinar series, and this is series 13 we are doing, and we are looking at quality assurance, beyond quality assurance, how we can put in quality management systems. And we have talked about quality in education, quality in patient care, quality in publications, in so many aspects of quality in primary healthcare. That was the last talk. So many aspects we have thought about. But is there quality in research? So that is the theme for today. And today's talk is a little bit more, has a philosophical indent to it, because we have with us the speaker, Professor Rakesh Aggarwal, who is the director of JIPMER. And he is going to talk about not only quality in research, but he has titled his talk as Quality and Integrity in Research. This is episode number 81 for you folks. That is what we will be doing today. And to do the welcome, I request our Dean, Professor P.F. Kotur, to take the mic. Sir, over to you.
Yeah, very good afternoon to all the participants and our distinguished speaker for today, Professor Rakesh Agarwal. In fact, I was mentioning a couple of minutes back that we have been ardently waiting for Professor Agarwal to come on this platform. Finally, the day has come. I'll say rather one more jewel in the triple F crown of AVMC. I can say that, and one or two thoughts. I won't be taking much of a time. We are all eager to hear Professor Agarwal. Two thoughts: being a teacher and being an educationist, we all know research and education are the two sides of the same coin. One cannot exist without the other. Even our the sustainable development goals, they have goal number 3 and 4 dedicated to education, dedicated to patient care. That means we here in the Institute of Higher Education of Health are supposed to provide the quality in all the scholarly activities we are doing. Patient care, of course, education or teaching learning. Third one is the research and even the administration. So we have amalgamation of all of these things. Professor Dr. Rakesh Agarwal, who is a physician, who is an academician, who is a researcher, and who is a able administrator, and who is heading the premier institutes of national importance here in our own Pondicherry, is here with us to share his first-hand thoughts on this very thought-provoking subject. And on this occasion, I welcome Professor Rakesh for this platform on behalf of our Honorable Chancellor, then university members of the Board of Management, our university, and all the staff and students of the AVMC. And I acknowledge the presence of the heads of the institution and other distinguished persons in the audience, and my colleagues, Dr. Bhatt, Dr. Mahalakshmi, Dr. Rajan, and other HODs. Over to you, Dr. Bhatt, to introduce, I think, Professor Rakesh. Yeah.
Good afternoon to everybody, respected Dean and Dr. Mahalakshmi, our Dean HPA, and senior colleagues. It is my privilege to introduce Professor Rakesh Aggarwal, who is the director of JIPMER at present. He has done his MBBS and MD from the prestigious All India Institute of Medical Science and TM in gastroenterology from PGA Chandigarh. Later, he has done a diploma in statistics. He's done MSc in epidemiology, and he has been trained in laboratory techniques in CDC Atlanta. So he is well trained both in academic research activities, and he is also an adjunct professor of Public Health Foundation of India, and he is an online teacher for epidemiology, MSc epidemiology in the London School of Tropical Medicine and Hygiene. He is in various bodies of WHO programs, and previously and currently. And his main interests are hepatitis B vaccine, hepatitis C vaccine, and he has done a lot of work on human papillomavirus, hepatitis A vaccine, And of course, being a gastroenterologist, of course, a lot of work is done in the gastroenterology aspect of it. He has published more than 300 papers and about 31 book chapters. His CV goes into pages, so as rightly put by him, because he has to leave for another meeting, I have shortened the CV, and I'm sure that he is the right person to talk on research. You would have read his article on the Medical Council of India guidelines, which journal to be accepted, which is not to be accepted, how it has to be done. Those articles, I think, highly quoted. The citations are, and it is my pleasure, because the moment I requested him, he said, yes, I will deliver the talk. So thankful to you, Professor Aggarwal, and I thank you all for patiently listening to me. Back to Mahalakshmi.
Thank you very much, sir, for that thing. Before we pass on, some few housekeeping announcements. We request all the participants to keep themselves on mute so that the audio quality is good for everyone. And for the information of participants, this program is being recorded and it is being transmitted live in YouTube, mainly for academic purposes. Over to you, Dr. Aggarwal. I have made you the presenter. The stage is yours.
Thank you, Professor Kotur, Professor Bhatt, Professor Mahalakshmi, and everyone who's on this call. Good afternoon. I am thankful for the kind words that have been said, some of which I don't really deserve, but I'll be talking to you today about quality and integrity in research. I know Dr. Mahalakshmi said at the beginning it's a somewhat philosophical talk. No, far from it. I think I'm going to talk about day-to-day mundane things that we do and how we can try and do that. Actually, to some extent, even day-to-day life is philosophical. So from that angle, yes, but otherwise, possibly not. So let me try and share my slides with you. Can you confirm, Dr. Dr.
Yes, sir. It is
you can see
visible,
my
sir.
slides?
Yeah.
So my topic today is quality and integrity in research. So why are we discussing this? This is because generation and dissemination of new knowledge. Let me just try and get this off my, of new knowledge is an essential part of academic pursuit in all sciences, including in medicine, as has already been said by the speakers before me. Society places a lot of premium on research in any science because it is generally believed, and it is true, that research benefits mankind. I'm going to show you some example of that in a little while. So in view of this respect that society has for research, it's important that we preserve this respect for research, and that can happen only if the society has continued confidence and trust in research and the research findings. If that trust is broken, society is not going to uh, place value on research, it's not going to support research, it's not going to fund research, and that would have consequences which will be harmful for the society at large. So this can happen, as I'll take you through some examples, if we maintain the quality and integrity of research. So what has research made possible? This is a slide that shows the expected survival at birth of world's population in different countries in the years 1800 in pink, in 1950, 150 years later in yellow, and in 2012, nearly 10 years ago, in green. And we have improved from there further in the last 10 years. If you see the developed part of the world, which started off with a somewhat better survival anyway, but the gap was very small, about 10 to 15 years, and we were at the bottom in 1800. Here, India is on the left. There was a major gain in life expectancy in the developed countries. And this has continued, albeit at a smaller pace, in the last 60 years. If we look at on the left side of the curve, we can see what has happened in India between 1950, when we became independent. Our expected survival was about 35 to 36 years, and it has gone to beyond 66 years, nearly doubled, which means in 60 years, life expectancy increased by more than 30 days. Every year, life expectancy increased by 6 months. This is possible only through fruits of scientific research. And they can't be a better example than the COVID vaccines that we have seen in the recent past. But now let's look at the other side. You all heard about what happens if the research quality and integrity are not of the highest standard. You've heard about what has happened with ivermectin in the treatment of COVID over the last few months. There was a systematic review. There were some studies published which showed that ivermectin was useful. It was used extensively, and then we had data that showed that it was not as useful because the study that we had initially was of poor quality. The results were not necessarily not correct, and that has led to medical science, each of us as doctors losing face, having egg on our face, and feeling bad about it. And the society is really looking at us whether anything in medicine really means anything. Similarly, if we look at the Surgisphere scandal, those of you who are familiar, when the COVID pandemic started, there were data published which were fraudulent, which were not true, showing some things about COVID. Again, they were later shown to be false, and so there was failure of integrity, and this led to loss of public's confidence in science. So it's important that we maintain quality and integrity. Now, these are very easy terms, and we heard that we have to be somewhat philosophical about these terms. So that is the only bit of philosophy that you would see. What exactly is quality? And I went to the dictionaries, and this is what they say: how good or bad something is. So if you have to look at quality of research, you look at whether a particular piece of research is good or bad. It looks at excellence, it looks at fineness, it looks at how it compares against a standard. And as we go further deeper, we realize that there is nothing absolute about quality. It is something that is measured against other things of the same kind. So you look at quality of one's research against quality of the research done by other people. And finally, when we look at this, it depends on what you are wanting from research. And depending whether it is able to satisfy that need, that is what decides the quality. So it is a totality. It is looking at multiple things together. Just having some good features does not mean quality. It has to have several good characteristics, and finally, it has to meet one's requirements. So then, what is quality research? Could vary from person to person, institution to institution, country to country, and what one does as a resident to what one does as a young faculty member to what one does as a senior researcher. However, if we have to discuss this, let's discuss it things which would be true irrespective of where we are and what kind of research we are doing. Good quality research has to be robust, meaning what it shows us is the truth and anything but the truth. It is ethical. It has to stand up to scrutiny of our peers, of our colleagues, and it has to help inform policy making, because all research, society invests in it so that we can improve our policies, we can improve human health in the case of health research. To do this, for it to be robust and ethical, we must adhere to principles of professionalism, medical profession principles. It should be transparent. We need to be accountable. Research has to be auditable, and it has to be relevant to the population where this research is done. Looking at it another way, here are 8 characteristics which can be actually divided into 4 different domains. We start with a study question. We go to study design. Based on this design, we conduct the study, and finally we report. And I have listed some of the important characteristics from each of these steps. Research has to be based on sound research question, and it has to acknowledge, take into account and be based on the previous research work that has already been done. This prevents waste. We don't repeat things which have been done previously, and science is incremental, leading to incremental changes in human health. The study design has to have an appropriate research methodology. It has to ensure that study that is done in a few people in the sample is representative. The sample is representative and the results are generalizable to the entire population that we are interested in. The way study is done, it has to have methods and they have to be followed correctly so that the data are reliable, the data are correct, and they are analyzed correctly, and the procedures are ethical. And finally, when we write it, it should be such that this research is replicable, others can reproduce it, it's totally transparent, there is nothing hidden. And finally, the research work has to acknowledge its own limitations by itself and provide suggestions for future how this work can be improved. And let's try to look at each of these briefly within the limited time that we have. For the study question, you can look up, and I'm sure many of you already know these criteria. The finer criteria is one way that we can summarize how a study question should be. The study question should be such that the research is feasible, it can be carried out, which means that it should be within the resources that we have available, within the money, patient material, and the skills and tools that we have available. It should be of interest to the researcher and to the population at large. It should be novel because that's what research is. It should be within the possible, within the ethical principles, and it should be relevant. And that means that it should be something, again, interesting and relevant to some extent overlap. So for this, the researcher who wants to do quality research must ensure that he looks at the prior literature on all aspects of the question to identify what has been done, what are the gaps. That also helps avoid duplication and to learn about potential obstacles and issues. Sometimes people look at a very focused, in a very focused manner on the study question that they are looking at. Let us say I'm interested in seeing whether a particular drug X would be useful in a particular disease. If I look at literature only for that, that may not be adequate. I need to do a wider literature reading, because if there are other drugs which are even safer than the drug that I am interested in, which are cheaper, which are drugs which are even cheaper than the drug I am interested in, this question of trying to look at drug X may have no meaning if we have other drugs available. So the context is very broad. You need to think when other people did the studies, what obstacles they faced, what were their challenges, what did they do to solve it, because that could give you ideas so that you avoid the same pitfalls. Once you have your question, you need to hone your question a bit like we sharpen our pencil and actually convert it into a testable hypothesis. And the acronym we have there is the PICO approach. We look at who will be the participants in our study. We need detailed inclusion and exclusion criteria. Where will we get these people from for human research? If this is lab research, then you need to know where to get the reagents from or animals that you're going to work with. You look at what intervention we are interested in, whether this is an intervention that we are going to give or an intervention that happens naturally in nature. We'll try to look at what are we going to compare this with, and that's a very important question. Any research done without a control has very limited meaning, whereas if we have control group, the meaning is very different. And very often we need multiple comparator groups, multiple control groups to come to a conclusion. And what is the outcome that we are interested in? The intervention and outcome can also sometimes be labeled as exposure and outcome in case of natural exposures. Some people add to this 4 components of PICO. We can look at the timeline. So if we are looking at outcome as pain relief, are we looking at pain relief at 1 day? Are we looking at pain relief at 1 week, 1 month? That could also be important. And a study design, because that decides a lot about the robustness of data, could be another important addition to the 4 components of PICO. One of the reasons where poor quality research actually fails is failure of the investigator to turn one's question, which is relatively broad, into a clear, unambiguous, focused hypothesis and a PICO question. Once one is able to convert a question into a PICO format, then the research design and carrying out the study become much easier. A lot of research that is done in our country and is of poor quality is actually because we have study questions are weak. And to me, this is actually the weakest part of the limb of good research. Very often our research lacks novelty. This is because we don't read a subject in depth. We don't have sufficient experience when we start doing research. And also very often we do repetitive studies. We read a study somewhere and we say, I will look at the same, and this will be the study for the first time in India, or for that matter in southern India, or for that matter in Pondicherry. The question then is there a reason why you expect something to be different in India, or for that matter in southern part of the country as compared to the rest of the country? If that's not something that you can justify, there is no point in doing a study, repetitive study, just because it's going to be first in a particular population. Also, this happens because we start thinking of the research project after we read a call for proposals. I look at a call for proposals for that Government of India is trying to fund studies on malaria. And that's when I decide that this is a good opportunity. I'm going to start writing a research project on malaria. That's not going to work. You need to be an expert in the field of malaria, either from your past work, or you need to sit and do really good reading for 6 months. Only then can you think of writing a good research project. And finally, very often it's one person, or at the most one person sitting with a student who works on a research idea and writes a research project. That's not how research projects should be done. Every research project must be discussed with many others from different experience, from different fields, and only then does it become a good research study. So very often we do all this because we are not interested in research. We are just interested in having some papers for promotion. And then if you start doing something at the spur of the moment, that cannot be good quality research. Let's come to the second part, and that is study design. There are different types of study designs. I'm not going to go into this in today's talk, but what one needs to do is to decide on a study design which will give the most valid and most reliable results. What is valid? Valid means it measures exactly what one wishes to measure and measures it accurately and precisely. Very often, for measuring the same thing, there can be multiple tools. If I want to measure air pollution, there are 100 ways. I can look at the pollution, measure something in the air. There are methods whereby I can get data from ISRO, and you look at a particular wavelength signals from a satellite image, and that can also tell you how much is the pollution. Which of these am I going to use depends on my study question. It depends on the resources available. It depends on the skills a person has. But one thing one must know, if you do not have a handle on a valid method to measure your most important variables, there is no point in doing the study. If you want to look at immune response to a vaccine, and let's say COVID vaccine, if what you need is a neutralization assay and that's not what you have, then there is no point in your doing the study using just the antibody test, a qualitative test that's available in the market, and that's what you have available to you. If you need something to be measured, you should be able to do it accurately. All the data, when you collect them, you must be thoroughly objective and unbiased. I've already said you must use the most reliable technique. One thing that I have followed in my research all through is that all the data that you need for research cannot come out of data that is collected routinely. If your study is about whether iron treatment leads to increase in hemoglobin of people, you cannot rely on hemoglobin measured in the hospital routine lab. You have to have greater care and vigilance in measuring that hemoglobin, and this applies to any variable that feeds into your research question. If you are looking at whether iron administration improves hemoglobin in pregnant women, question is related to iron administration. You need to be sure that your tablets contain what you want. They have to be all of this from the same source. You have to make sure that they are administered, or at the very least, you need to measure compliance and you need to measure hemoglobin using a special method in a specially careful lab rather than as a matter of routine. Very often you need to make attempts to double check the critical findings. So if you are wanting to look at whether it improves iron deficiency, not only would you measure hemoglobin, it's best to measure some other marker of iron deficiency also, and that too should be measured specifically for your research lab and not as a matter of routine. People would say that there are people who send out material for testing elsewhere. Yes, if you want to get sequencing done, get sequencing done. But there, the most important part is the analysis of data. If you get DNA sequencing done, you are the one who has to look at the quality of data and to do the data analysis. That cannot be left to an external person. So to improve the study design, it's important for you to have deep knowledge of the subject and the related fields. So you need to read, discuss with others, invite inputs, invite criticism, accept that criticism, digest it, and use it to improve the study design. So before one becomes an expert researcher, one needs to become a learner or a student. If there is something that you do not have skills on, you need to get a collaborator. But a collaborator should not be somebody who's easily available. So if I want to do something that I want to measure in the lab, somebody who has done it occasionally in JIPMER may not be the best collaborator. I might have to collaborate with somebody who's an expert in this, who does this day in and day out, could be anywhere in the world, and he should be willing. A person with whom frequent interaction should be possible. Ideal situation is if you can find a person with whom you can have a win-win relationship. You think the person would be interested in your question. He doesn't have access to the patient material and you do not have access to the lab method, but both of you can do one part of the thing, and if you join hands, you can do it. That's what a collaborator is. Sometimes you will need to have a multicentric study. You will need to find partners. Again, same principles apply. They should be the best people in the world, if not in the world, in the country, in the region, and not just who's easily available if we want to improve the quality of research. The research should be logical and generalizable. You need to think that whether the people you are choosing to include in the study, whatever you find in them, will it apply to everybody in the larger group, in the larger population? This again requires knowledge of the subject. You need to know how different patients of the same disease could differ. What could be the associations? What could be the possible confounders? Where could be the biases? And this needs an ability to think logically, a good sense of science in general, and then a deeper subject of the particular subject that you are dealing with. Why do we end up with poor design and conduct of studies? Again, as I said, with designing a study is asking a research question, it's lack of deep knowledge of the subject. Lack of focus. A person works in too many unrelated areas. You cannot be a master of all areas. For instance, I have practiced gastroenterology and some areas beyond that. But for my research, I have focused on one or two areas, hepatitis, microbiome, but not on everything. I have avoided doing research on inflammatory bowel disease, pancreatobiliary disease. They are excellent areas for research, but I cannot be expert in too many areas. Spending too little time on planning the study, being too reliant on students and working on students' ideas. There could be a difference of opinion. Many of us think that a new student will join, a PhD student will join, we'll ask the student what the student is going to work on, wants to work on, and then we will design research. To me, that doesn't work. Your research has to be in the area that you work in. The student may have some preferences, but within the wider canvas of, or within the narrow canvas of what you are interested in, and within that he can have his choice. We fail to discuss our ideas with others. We somehow think that research is easy. We fail to understand the commitment, time, energy, and the money and number of subjects that we would need for the study, and therefore we end up designing a poor study. Also, we often do not have the technical skills and expertise and do not make efforts to learn that. If we want good research, then we need to make sure that we do all this. When designing the study, we think of variables that we have easily available. It's done in our lab rather than on accuracy and validity. We collect data on too many variables. So you would see people will have a data collection form which will run into 6 pages, 8 pages. Let's collect all the data and then we would choose at the end what we are going to report. That doesn't work. Anything that is more than 2 pages is unlikely to be filled properly, and that is another reason for poor research in our country often. If you want to measure something, you have to standardize. One of my colleagues, a pediatrician, said, if I'm looking at a child with diarrhea, I have to measure the stool weight in neonates. So I have to have a balance and I have to weigh every nappy before it is put on the baby and after the baby is passes stool and it is removed, to measure how much stool the baby has passed and to the last gram. That's what we mean by standardization of measurements. Once the study starts, we don't periodically look at what is happening in the study, and we look at the data again after 1 year when data have been collected and we find several pieces of data are missing. Why? Because some equipment had stopped working. If we had done periodic, let's say monthly review meetings, we would have known when things were going wrong and we could have taken a corrective step. And nobody works, including you and I, until we are supervised. So don't have too much faith on project staff. You need to supervise them. With that, let me change gears and move on to integrity. What is integrity? Integrity is the quality of being honest and having strong moral principles. If you see from other dictionaries, again, the word moral shouts at us. That is what we are meaning, which means being right and wrong in terms of behavior. The opposite of integrity, or when integrity is not there, what we do is misconduct, which relates to unacceptable or improper behavior, intentionally doing something wrong. But very often, this is not something that by criminal law will be considered or by any law will be considered as wrong, but it is not something that we expect people to do. So this is lack of integrity can mean misconduct of a lower level than what is considered as illegal. So what is expected, the level of integrity expected in research is much higher than breaking or maintaining the law. Some of the examples of scientific misconduct I have tried to list here. Unethical research, that's not something that I'm going to talk about because that's a part of conduct of research. Fabrication, falsification, plagiarism, selective reporting of data, redundant publication, inappropriate authorship, and undeclared conflict of interests are the important types of scientific misconduct that happen. They happen in our country also, and we need to be careful of those if we have to maintain public's confidence in research. So what is each of these? Let's first start with fabrication. Fabrication is making up results and then report them. Some people think this means that you do not do anything and you make up the whole paper. Yes, that surely is fabrication, but more often the fabrication that happens is of a much smaller degree, but is fabrication nevertheless, is misconduct nevertheless. You collect data on 50 patients, you make your table, and then you realize that for 5 patients, you don't have age. Now, you make up the age, knowing that most of the patients of this disease are 50 to 60 years of age, and you write 52 or whatever. You may think this is only small amount of change, this does not matter, but no, this is fabrication. Even if you fabricate one piece of data, it is fabrication. This can happen while doing research. So you leave out a particular control in your research, or you do it while doing clinical data collection, at any level, it is fabrication. So don't make up data when you are sitting down to write paper. This can be prevented, if a lot of it can be prevented, if we are careful during design of study, and more importantly, if we have periodic meetings to look at how data collection is going and what is being done in the project, then this kind of misconduct can be avoided. Second thing is a way to look at falsification is falsification, where a person manipulates the research materials, equipments, or processes so that the findings are changed and the final result is not an accurate representation of the truth. This can be altering some values, this can be concealing some values, this can be withholding some values, or if some values or you are not entirely truthful, you are not telling a lie, but you are not being fully open about what you did. That was all falsification. This can happen with clinical data, this can happen with photographs, this can happen with gel pictures, this can happen with photographs, and I'm going to show some of the image related things because that's relatively new. It can happen by saying we enrolled 100 patients in the study and say 10 left the study, where actually you know that they did not leave the study, but their data were not fitting in, and so you decided to exclude their data. That is also falsification. So let's look at some examples. Let's look at this paper published about 10 years ago. And in particular, I'll say that let's look at this figure D that is here. So cells were cultured, curcumin was added in different concentration to different cell lines, and some images were taken, and we are going to compare these two marked by a red box and the two marked by a green box. Let's look at first two, those marked by a red box. And the investigators reported that 3% of cells and 23% of cells showed staining or showed a certain degree of intensity of light at 0 minutes and 10 minutes, at 0 concentration of curcumin and 10 concentration of curcumin. If you see, there is a difference between the two images. Many things are similar, but we can see some extra cells there. But this cannot be two cultures done at different concentrations of curcumin. This is because the same cell culture was developed for a longer period of time, so that even cells which had lesser intensity of light, for instance here, started to show up over time. So the experiment was not done, the same was not done as it is made out to be, and this is falsification in the form of image manipulation. Let's look at the other two images that I had placed with a green box, and we now see here something like that does not exist. These images are very different, but just flip this image around 180 degree, and now you can see this image and this image are identical. Again, this was cheating, this was manipulation, this was falsification. The main thing one needs to realize is, at one time it was difficult to detect this. These days there are computer programs and journals actually have started to use them. You put in the paper and out comes a result, and it picks up all such things, and these things will be picked up. Another paper, an author with an Indian name, different experiments, and you can see this image and this image are virtually identical, except that one has been developed for a longer duration of time. Look at this part, it looks as the same as the pink part here. The one in blue box here in one experiment is the same as blue in the other blue box in the other experiment. So this is a practice which is fairly common, and one needs to be very careful about this. Two different embryos, one with a wild type strain, one from a knockout embryo, passed off in a journal paper. But if you look at this carefully, every point where light is being reflected is identical. Even identical twins have minor differences. Such identity is just not possible in nature, and it was easily picked up by the journal or by somebody who wrote to the journal saying that this is image manipulation, falsification. This was not actually how things were done. There are things beyond this. So this is an interesting paper published about 15 years ago. where these authors looked at papers published by a department of a university in India, and they said in all the papers, you take any value of mean and SD, there is a certain relationship which is running across their papers, and that is something that cannot happen if one were to do research, and suggesting that there are issues, there is something happening about data in that department. So do remember, if we do anything like this today, it is likely to be picked up and it's going to bring us disrepute. When you do something, you need to have records. People will ask you for records. So there is this paper that was published from India in New England Journal of Medicine, but was retracted some months later because some things, data within the tables did not match each other. That was raised in a letter. The journal asked the authors for more detailed data, and they said those registers are not available. The journal wasn't sure that there was a problem with the data. They still thought data were okay, but because no primary source could be produced, the journal went ahead and retracted the paper. There are things that investigators do more often than what I have shown you. You would find studies where the comparator used is weak. When you are trying out a new drug, you compare it with, let's say, a known antibiotic, but you do not give the standard treatment in full dose, but you give a lower dose so that the new drug would appear much more useful compared to the previous drug. That is, again, lack of integrity. Or if you're looking at adverse events, you give a higher dose of the competitor's drug or the older well-known drug. A more commonly done thing is to study multiple endpoints. You have 10 endpoints, you look at all of them, and you report only those that show improvement and forgetting about those that do not show improvement, or for that matter, show worsening. You do a study, you enroll people, you take their consent, you do the study, and you find negative results, and you fail to publish this because somebody, let's say the pharma company that gave you the product, does not want you to publish. That itself, even failure to publish, is a matter of lack of integrity. Another issue is the conflict of interest. A conflict of interest exists when there is a divergence between an individual's own interests and her responsibility to science. So what happens is, you do something, you don't tell people that you have some other interest, and when that becomes known, then people are wondering whether what you found, what you have reported, could have happened because you could have other motives. This happens. Let us say if I were to do a study on a drug and show that it works in COVID, I have stocks in that drug company. So if I say this upfront, then people find it acceptable. But let us say I don't announce this. After I have published the paper, it somehow gets known that I have stocks in that pharma company. Then what is going to be thought about is that there may have been some reason for me to get positive results, and that could have been responsible for what I did. And these interests may not always be financial, can sometimes be academic, can sometimes be personal. I get a paper to review because it belongs to my colleague. I may give a more positive review than what I actually think. Plagiarism. I think people are aware of what plagiarism is. You take somebody else's ideas or words and you use those without acknowledgement. Internet has contributed to its increase because now you can get a PDF, copy things from there and put the same thing into your papers. But at the same time, it has also made it easy to detect. The moment you publish, all people can take your text, put it in a software tool, and it will tell you where you have taken it from, and it's not acceptable. It's fairly common in India. You can see any number of Indian papers that are retracted for plagiarism. Wikipedia has a specific separate page on plagiarism in India in science, and one needs to be very careful about this. Repetitive publication, publishing the same data twice, another failure of integrity. And again, it's fairly common in our country, and we need to be careful because this is likely to be detected today and you are going to get a loss of face. So friends, In the end, let me summarize. We talked about two concepts: quality of research and integrity in research. If you want to make that your research is of good quality, you need to do relevant research. That is something that is relevant to our population, relevant to our practice, and do something that is feasible today, not what is in fashion. I cannot, if I something a disease that is not common here, there is no point my doing research on histoplasmosis, which is not a problem for me. There is no point in doing research on a disease that I do not see very often. I should leave that to others. Secondly, we need to focus, have one, two, or a few research interests and consistently work in those areas. Yes, you can change your field, but only once in a few years, not very frequently. This is what my mentor used to call the grazing cow syndrome. A cow goes into a field, eats a little bit of grass here, then thinks grass is greener on the other side, walks there, has that grass, and then at a third place and a fourth place. That's not how research works. Find a good mentor. This could be a senior, this could be a colleague, and learn from the person. Whatever research ideas you have, run by that person, run by your colleagues, and only then will you be able to do good research. Acquire new skills, new knowledge. If you want to do any research, you need to acquire all skills related to that yourself, or find a collaborator. The collaborator should be a person who is genuinely collaborating and not just a person who's supplying you specimens, or you are supplying them specimens and they are doing something and sending you the report back. You have to meet frequently, discuss frequently, and troubleshoot together. Aim for excellence. Don't settle for something midway. If you settle for something small, then that's not research. The path to research is slow and tedious, but you can reach there. Integrity. Research requires a very high level of integrity. If you don't have that, if you don't intend doing that, don't do research. Avoid prejudging the question. You should not be expecting only results in one direction and be surprised or shocked or sad if you get results in the opposite direction. Have true love for science, for asking questions rather than papers. If you develop love for science, papers will come automatically. You won't have to think about papers. Finally, if you are not sure of your methods or results, be transparent. See that you think that there could be a problem, and still I'm reporting these results, but these need to be taken with a bit of salt. People are happier that way if they know that there could be a limitation rather than results which are couched in superlative language. While doing research, spend time on developing a good research question, on designing your study well, but even during the conduct of study, pay meticulous attention to detail and record keeping. Periodically sit with your team, look at the data, see if something is not being collected and why, and correct that right at that stage rather than at the end, because at the end nothing can be done. Finally, you need to train your staff, you need to supervise your staff, both in terms of study methods and on integrity per se. The atmosphere has to be such that they should be able to open up and speak to you if something has gone wrong, rather than give you falsified data, fabricated data, because they feel that if they are going to tell you, you are going to shout back at them, and that's not correct. Finally, for both quality and research integrity, be patient, do not be in a hurry. Research is aside. The most important thing that you have is your reputation. That is your biggest asset. And if you slip up in research integrity area, your reputation will be damaged. It's just not your research record. So, and that cannot be repaired. And therefore, it's important to make sure that you do good quality and research with integrity. Thank you. With that, I'll stop sharing my screen. And if there are any questions, I'm willing to take those up.
Yeah. Thank you very much, sir. That was a fantastic talk. You were telling in the beginning that this is not philosophical. You are grounding it on practicality, and I think you left it. But it also raises some questions. Like the first, one of the very first slides, you talked about trust in research, right? on trust in how the knowledge is produced. So I was just thinking that the whole talk focused on two aspects. One is ethical aspects of conducting research, and the other is epistemic aspect of research. No? How you can rely on the knowledge or the degree of validity of the knowledge which has been produced. I think that is the most important takeaway from the entire thing, from conceptualizing to doing and to taking it forward. I have one question to start the discussion. Currently, sir, research is more like is done more in socio-political context, both in terms of organizations as well as the ideas. So there is a very complex relationship which exists between incentives for research and integrity for research. There is also a lot of pressure from the system, and we can even say pervasive incentives to take this
So,
forward.
yeah,
What's your
so,
take on
you know,
this, sir?
so I think we need to be clear what we wish to do. Uh, when we join a job, we know what is being expected of us. I can show you, I have nephews and nieces who work in management firms, and they are very clear that whatever companies their management company is providing consultation to, they are not supposed to buy or invest in shares, and if they have any shares in that, to reveal it very clearly. Something that I and you will find it very difficult, but they do it naturally. And same way, I think we have to be very clear. We have to understand people are not expect. So I said, started from saying that research at different levels is different. The research that we are expected to do as faculty members is actually very simple research. You need to look at questions that you have. The purpose of that is to teach you the research method, scientific method, because that, at least I find that if you keep asking questions, if you keep understanding how things are measured, how things are done, it helps you understand the science that you read and the science that you apply in the clinic. That is the purpose. To think that every MD thesis will mean a paper is not correct. So you need to think, and if you find this is too onerous, nobody is forcing us to be on the faculty. There are other avenues available to us. We can go ahead and do that. What is stopping me? And the amount of papers that MCI or NMC wants is very few. I don't think that is a problem, even if one were to, to me, that is not really a major problem. It's just that we look at research from a slightly crooked angle, and we're trying to do this uh, in the shortest possible time. Heavens will not fall if I don't get my promotion for 2 years. Let me do a good job. At least that's how I have looked at research. I'll stop here.
Thank you, sir.
Professor Rakesh, in fact, I put those questions in the question box.
Yes, sir.
What is a lesson we have learned as regards the quality and integrity of research during COVID pandemic? Because you refer ivermectin, so many studies retracted, those kind of things have happened. What is the message or what lesson you think we have
So
learned?
I really don't know. Each of us has learned different messages. For patient care, let's look at what message have we learned. I believe, and I said this in a meeting of in Tamil Nadu chapter of Indian Society of Gastroenterology recently. Most of us have forgotten that we had two epidemics. There was a COVID epidemic, which was all over the world, and there was another infectious disease epidemic that was restricted to India, Bangladesh, Pakistan, etc., etc. And we have all forgotten about it. We had 55,000 of patients with mucormycosis. That's the largest iatrogenic epidemic of any infectious disease. What have we learned from it? People still continue to use steroids indiscriminately for other causes, right? So what people have learned, different people have learned different things. To me, that's the learning from clinical management, that our clinical management needs to be evidence-based rather than non-evidence-based. Same way for research, I think there have been excellent examples of how research should proceed, how even before Omicron became a household word, from South Africa, we had data which very clearly showed that this was not going to be what the previous waves were. We had those data available within 10 to 15 days of Omicron being identified. We had vaccines in a year. We knew about what happens with interval of 4 weeks and 12 or 12 weeks. We know what boosters do. Everything we have done so fast, but at the same time, there have been negative stories. So it's a mixed picture, but overall, the beneficial effects of research have far outweighed the poor quality research.
Yeah. And my second
Sorry,
question,
I cannot see the chat box.
Yeah, sir. You being an educationist too, one question. Second question is as regards the quality and integrity of research, as regards the qualitative research. How do you measure?
Quantitative versus qualitative?
No. How do you measure the quality and ensure integrity in qualitative research?
See, ultimately, integrity cannot be measured. Failure of integrity can be identified. Presence of integrity cannot be ensured. Ultimately, it is up to an individual investigator what they do. The scientific milieu presumes that integrity is there until proven otherwise. No journal ever asks you to produce the original readings, or for that matter, even the invoice that you bought those test kits and reagents that you say you used, right? So integrity is taken as a given until proven otherwise. At least that's my understanding. Nobody has ever questioned. They have taken this only when it is proven that you slipped. That comes to light.
Thank you, Dr.
So,
Rakesh.
yeah. So somebody says okay, now I got the chat box. Consider clinical research as no research. I wouldn't say so. Clinical research can be research, provided you look for something novel and you find something novel. So a lot of data that came, let's say, from South Africa, which said with Omicron, in the last 1 month, the cases we have these characteristics compared to what we had in the previous wave. That was clinical research. That was research that was useful. So to me, that is research. But the question has to be novel. Just taking 50 patients of the disease and saying, picture in Pondicherry is different from that in Haryana is not research. That may not be true because all the difference that you show is they have 40% something and you have 50% something. Your average age of patients with some cancer is 50 years, and in the US it is 65 years. But that is because your population overall is younger, so you would see that difference. So that may not be. But if you have a real good question, clinical research can be research. How do we measure quality? At least to me, there is no way to measure quality. I sincerely believe that looking at the impact factor of a paper, the journal in which you publish the paper is surely not a measure of quality, not at least a direct measure of quality. So you said peer reviewing a colleague's paper familiarity breeds consent. No, I didn't mean consent. What I meant was, if a journal were to send me a paper to review and I find it is of somebody with whom I have worked in the past or whom I know very well, it is expected that I will write to the editor saying that this is a person whom I know in this capacity, and I therefore think it may not be appropriate for me to review. At least I have informed the journal beforehand. If the journal editor still says, okay, now that you've told me, you still go ahead and review, and I can look at it in the light of the fact that the person was known to you, then it's no longer a conflict of interest. Don't you think quality and integrity should be internalized? Absolutely. And that's what I said. These cannot be measured. This is what you look at. This is how you look at things. But of course, people are going to also look at it and they are going to judge in their own manner. But these things cannot be enforced. These are things that have to come from within. I absolutely agree with that, Dr. Bhatt. What percentage of medical malpractice in your research malpractice in opinion will be missed by the reviewer? As a reviewer, I can miss totally all kinds of uh, falsehood. If somebody says that they did electron microscopy of something, 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 and they provide me images and I am convinced about them, I would go ahead and take it. And it's possible that they don't even have an electron microscope, for instance. So even that could happen. Peer review cannot pick up research misconduct. It can miss it altogether. It can only pick up a very small proportion of it. That is up to people within the institution, people around them, or people who read the paper to pick up. What about knowledge gap? What is expected by what I mean by reducing the gap is you need to look at what is not known or what is the gap in treatment of people. So for instance, let us say I have a drug which I use to treat hepatitis C. It's perfectly fine, we are using it, except that it is not useful in patients with, it cannot be given to people with renal failure because it has a renal excretion. So the gap in knowledge is we have drugs available to treat a particular condition overall, but in people who also have chronic renal failure in addition, we do not know what to do. So that's a gap in knowledge. Now this gap in knowledge could be bridged in different ways. Could there be another drug which could be useful? Is there a way that I could modify the dose of the drug so as to be able to give it to people with renal failure? Could it be that I could give it immediately before or immediately after dialysis? So all those are the gaps that you could fill in.
There's a question about introducing research as part of medical education from day one of medical college education. So, not a
So,
question, it's more like a comment.
yeah. So my views are somewhere in between. I think trying to introduce research from day one doesn't work. There are things that have to be done at different phases of life. At that stage, you can tell them there is something called research. You can tell them that the basic principles of research, but somehow I think we are trying to take it to a very preliminary level. I don't think MBBS students are really ready to do research which will be of use to medicine. I'm fine if you teach them research about, let us say, uh, whether, so basically we can teach them the principles of research, but to expect that the research they do will be useful to medical science, I don't think so. And that is actually true even for majority of MD theses that we have. The research that is useful will be of a different level. A faculty member, in addition to guiding research in students, has to have projects of his own, her own, and those are the ones that will be able to contribute to the scientific body that is useful for patients.
There's one very interesting question, sir, from Dr. Arun Daniel. He wants to know that if you're going to use community-based data collection and you link it to GPS tools like EpiCollect, will it solve integrity issues?
So some issues will be resolved, some will not be. So technology is being used to improve data collection in research a lot. So you can say that you can make sure that the person will go to the house of the person where data is to be collected. But would he knock at the door? Would he ask the right question? Would he fill in the answer correctly? You cannot ensure. Yes, there are tools. So people found that when people report adherence to drug taking, they don't even open the bottle and the tick mark that we took the tablets. But people have tried to put in sensors into the bottle lid. Only when it opens can it be seen. But then you can open the bottle and close it without taking the tablet. So that is how it can be.
There's another question like, will a central ethics committee for all medical colleges in a state, can it keep an eye on the falsification or fabrication which is used in promotion of research?
I don't think falsification or fabrication of data can be kept in check by anybody. If your local people cannot keep in check, how can somebody sitting at a distance do? If I decide without asking the patient, do you have pain or not, and I tick mark that there is no pain, how can anybody ever detect it? It has to come from within. It has to come from the love of research rather than from, I don't think anybody can police this. This is just not possible.
So when you're talking about love of research, I kind of, the last slide you showed us that think about pursuit of knowledge. rather than run behind papers. I think something to that effect you said, no? So that was, I think, Kabil Bano, Kamyabi Piche Aayegi. So that is what I think what came from that.
Unfortunately, as a society, I think we have done something wrong, if you ask me. I think what we should have done is people's salaries continue to increase, irrespective of publications. But some designations don't come without publications. If I were to think of the system all over again, I would say your pay levels keep going up with years of clinical work. But the designation professor, let's say, would be given only to those who are engaging in pursuit of research. Otherwise, you're just called a senior consultant. Would that work? Possibly, yes. So also we have to possibly think that everybody is not necessarily interested in research. But I must say that being a researcher has helped me teach better and to see my patients better. And if you start engaging in true research, you would find that it helps you also.
Thank you very much, sir. Actually, we said that this talk is not philosophical, but I think we are ending on a philosophical note, like how as a society we have progressed, and it is 4-1 now. So we would like to close this meeting by thanking you profusely for the time you have spent, and also with the passion with which you have delivered this talk. Any final comments, Dr. Vishnubhat, sir?
I think it was a wonderful talk from his personal experience. Of course, this mad race of publication, as he rightly put it, I think has put quality in the background sometimes. It is whatever we said and done, it is very difficult to maintain the quality and integrity unless it's internalized. We can sensitize people, we can talk to people, we can monitor to some extent, but it, as he rightly said, it's almost impossible to pick up sometimes before we realize some mistake has been done. Anyhow, thank you very much, sir. It was a good talk.
Thank you, Dr. Bhatt, and Dr. Kotur for asking me to be there. And thanks, ma'am. You have been an excellent host. Bye-bye.
Thank you very much, sir. Thank you for doing this session. And before we sign off, we would like to remind the participant, we will continue our quest for quality. And next week, we have a speaker who is currently present in today's session, Dr. Medha Joshi, who is a consultant to medical education at M.S. Ramaya Institute, Bangalore. So she is going to talk to us about quality, accreditations, and standards in education, how they can bring about quality. So that is the next episode. That is episode 82 for you folks. And till then, we'll request all of you to stay safe. And you can watch all our sessions in AVMC Puducherry YouTube videos. So you could go back and listen to all the talks which we have had so far. Subscribe to our channel so that you would get the notifications in your inbox. That also is possible. So with that, we would like to conclude today's session. Thank you very much, everyone, for joining. Thank you.
Thank you.
I'll close this session.